Hi, Assalamualaikum and a very good morning to our beloved Madam Hazwani and dear friends. We are Group 7 and today we will be presenting on topic of COVID-19. My name is SOFEA binti SHAHRIZAL and these are my group members KARLVESTER, AINA BATRISYIA, ATHIRAH, SITI ZULAIKHA, AINA NABILAH, NAZIHAH and NURATIQA. Without further delay, I would like to begin with the first part of our presentation. Firstly, introduction of COVID-19. Coronavirus disease COVID-19 is an infectious disease caused by the severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 virus. SARS-CoV-2 likely crossed species before spreading, mainly through human-to-human transmission. Its pandemic poses a major global health threat and was first identified in December 2019 among patients exposed at a seafood market in Wuhan, China. The COVID-19 pandemic has been more widespread and severe. By March 15, 2020, it has spread to 34 provinces in China and 144 countries across 5 continents. WHO 2020. Next, the history of COVID-19 epidemic progression in Malaysia. First wave of outbreak, January 25 to February 15, 22 cases. The first 3 cases of COVID-19 in Malaysia were imported cases confirmed on January 25, 2020. Imported cases are defined as infection acquired from outside Malaysia with reference to the travel history of the individual case. It spread to the entire country and created a worrying situation, especially for Malaysian citizens who were overseas. Next, we will look at symptoms of COVID-19. Fever or chills, cough or sore throat, shortness of breath or difficulty breathing, congestion or runny nose, new loss of taste or smell, fatigue or headache, muscle or body aches, nausea or vomiting, diarrhea. Next, a structure of coronavirus. It have an envelope, and inside of envelope have genetic material and nucleocapsid proteins. Outside of coronavirus structure have an E proteins, also a spike, which is glycoproteins and M proteins.
Okay, I will talk about the terminology that related to COVID-19. First is pandemic. Pandemic is a global spread of a disease affecting many countries and population at the same time. Second is outbreak. Outbreak is a sudden rise in cases in one place. Seterusnya adalah epidemic. Epidemic ialah keadaan di mana the disease spread more widely in a region. Keempat adalah variants of concern, which is a mutated virus strain that spread faster, cause severe illness or reduce vaccine protection. Kelima adalah endemic phase, which is di mana fasa penyakit tersebut continue to exist at stable and predictable level in a population. Seterusnya adalah non-pharmaceutical intervention, iaitu preventive action like wearing mask, social distancing, and hand hygiene use without medicine or vaccine to prevent the disease. Seterusnya adalah herd immunity, which is occur when enough people are immune so that the disease spread is getting reduced. Last but not least is long COVID post-acute sequel, which is the lasting symptom such as fatigue or breathing problems after the initial infection. Next, I will talk about COVID-19 categorized disease. First is communicable infectious disease. COVID-19 is communicable because it spreads easily from one person to another. Second is viral infection. It is a viral infection caused by the SARS-CoV-2 coronavirus, not by bacteria. Third is respiratory disease. COVID-19 mainly affect the lung and breathing system, leading to cough, pneumonia, and breathing problems. Last but not least, zoonotic origin. It is zoonotic origin because it likely came from animal before infecting humans.
Next, I will continue this video presentation with COVID-19 principle. COVID-19 may attack not only your lung and respiratory system, but also other part of the body. Most people have mild symptoms, but some can become very sick. COVID-19 spread when an infected person releases droplets and small particles with the virus. Others can breathe them in or they can enter through the eyes, nose, or mouth. Then, how does COVID-19 infect a cell? COVID-19 enters the body through the nose or mouth, beginning its infection in the respiratory tract. Coronavirus uses its outer spike protein to attach to the cell receptor in the respiratory tract. In COVID-19, this attachment occurs at the ACE2 receptor. This binding allows the virus to fuse with human cell. The viral envelope joins with the cell membrane, releasing the virus genetic material inside. The virus carries its genetic blueprint as RNA, which acts like a message directing the host cell to make protein for new virus particle.
So, we're going on to the drug that used to treat COVID-19 infection. So, the first one is nirmatrelvir, second one is ritonavir, and thirdly, combination of nirmatrelvir and ritonavir.
Pertama, mari kita bincangkan pharmacological treatments. Antiviral, nirmatrelvir, ritonavir, dan Paxlovid ialah ubat yang menghalang virus daripada lebih merebak dalam badan. Ini diberikan kepada pesakit yang dimasukkan ke hospital atau pesakit yang berisiko tinggi untuk cegah komplikasi dan mempercepatkan pemulihan. Seterusnya, obat anti-inflammation, contohnya dexamethasone. Obat ini mengurangkan keradangan paru-paru akibat tindak balas sistem imun. Supportive care ataupun rawatan sokongan ialah termasuk oksigen terapi. Rawatan ini bantu untuk menyokong fungsi organ dan mengurangkan komplikasi pada pesakit yang kritikal. Symptomatic treatment. Ini ialah keseringan COVID-19 yang boleh dikawal dengan paracetamol atau NSAID seperti ibuprofen untuk menurunkan demam, sakit badan atau sakit kepala. Vaksin. Pfizer, Moderna, AstraZeneca ialah dos penggalak ataupun booster yang memberi perlindungan tambahan terhadap virus COVID-19. Seterusnya, kita lihat pula kepada non-pharmacological treatment, iaitu langkah pencegahan dan kawalan. Mask. Penggunaan surgical mask atau N95 dapat menghalang titisan pernafasan dari tersebar dan mengurangkan penularan dalam komuniti. Lockdown atau perintah kawalan pergerakan ialah langkah yang dijalankan seperti duduk di rumah, menutup perniagaan dan sekatan perjalanan, mengurangkan kontak antara individu serta memperlahankan penularan virus. Hand hygiene, penggunaan hand sanitizer yang beralkohol lebih dari 60% dan mencuci tangan dengan betul dapat membunuh virus pada tangan. Physical distancing ataupun penjarakan fizikal, individu mesti menjaga jarak antara 1 hingga 2 meter antara individu yang lain agar dapat mengurangkan risiko berjangkit daripada COVID-19. Maka perlu elak tempat sesak atau tertutup untuk karantin. Individu yang positif atau kontak rapat perlu dikarantin selama 10 hingga 14 hari. Langkah ini dapat memutuskan rantaian penularan dan melindungi individu yang sihat.
Okay, so we begin with the drug to use to treat COVID-19 infection. First of all is nirmatrelvir. Nirmatrelvir is from protease inhibitor pharmacological class. The mechanism of action of nirmatrelvir is to block the action of protein or enzyme. By this, COVID-19 life cycle is interrupted and the viral replication also not happen. So COVID-19 virus will stop replicating and the infection not happen. The side effect of the nirmatrelvir can causes diarrhea, muscle aches, changes of taste, and nausea. The interaction of take nirmatrelvir for COVID-19 is avoid St. John's wort flowers because the St. John's wort flowers can reduce the blood level of nirmatrelvir and make nirmatrelvir less effective to treat COVID-19 infection. And the contraindication for nirmatrelvir can cause hypersensitivity reaction, and Stevens-Johnson syndrome can happen to those COVID-19 patients.
Next drug used for COVID-19 treatment is ritonavir. Ritonavir primarily used to treat HIV by inhibiting the protease enzyme, but in the case of COVID-19, it works differently. So, mechanism of action for ritonavir in treating COVID-19 is ritonavir boosts nirmatrelvir by blocking CYP3A4. It slows nirmatrelvir's breakdown, keeping it active longer. So, this means ritonavir enhances the effect of nirmatrelvir by blocking CYP3A4. CYP3A4 is an enzyme that normally breaks down drugs in the body. Although ritonavir does not act directly on the virus COVID-19, it helps nirmatrelvir stay active longer by slowing its breakdown. Next, side effect of ritonavir. Side effect of ritonavir is diarrhea, numbness, burning or tingling of the hands, feet, or area around the mouth, tiredness, and weakness. Interaction, avoid St. John's wort, contraindication, liver complication, hypersensitivity, and severe heart conditions such as arrhythmia. Next drug used for COVID-19 treatment is Paxlovid. Paxlovid is a combination of nirmatrelvir and ritonavir. So, the mechanism of action, nirmatrelvir inhibits SARS-CoV-2 main protease, preventing viral replication. And ritonavir enhances nirmatrelvir by inhibit CYP3A4, slowing its breakdown and increasing its effectiveness. This means the combination of nirmatrelvir and ritonavir is more effective in treating COVID-19, as it allows nirmatrelvir to remain in the body longer and work efficiently to block the virus COVID-19 itself.
So basically, every medicine has a side effect. So the side effect of combination of ritonavir and nirmatrelvir is metallic test or bitter test, diarrhea, high blood pressure, abdominal pain, nausea, muscle aches, or changes in the sense of taste. And the interaction of this combination or Paxlovid is hormonal birth control of medicines because hormonal birth contain estrogen lah. And the contraindication for Paxlovid is hypersensitivity reaction, and Stevens-Johnson syndrome.
Okay, selamat pagi. Saya akan membentang tentang appropriate strategies to reduce infection. Okay, Pertama, maintaining hand hygiene reduce the risk of viral transmission between hand touch sites and mucous membrane. Ini boleh mengelakkan penyebaran virus secara formit. Itu bila sesuatu kawasan telah dikontaminasi dengan virus, dia boleh merebak dengan pesakit lain melalui sentuhan. Okay, sini kita boleh lihat hand hygiene compliance rate in patient unit dan ICU. Okay, ini sebelum pandemik. Compliant hand hygiene kurang berbanding dengan after pandemic. Bermaksudnya, strategi ni adalah salah satu strategi yang sangat efektif. Sehingga 92.8% patient dalam inpatient unit dan ICU compliant dengan hand hygiene. Seterusnya adalah stay home and practice isolation when having a respiratory virus symptoms to prevent viral transmission. Okay, isolation ataupun PKP ataupun MCO adalah salah satu strategi yang sangat dikenali oleh ramai untuk mengelakkan daripada perebakan virus melalui simptom. Lagi-lagi respiratory virus seperti COVID-19. Okay, ini adalah updated COVID-19 isolation guidance. If you have COVID-19, stay home selama 1 hari ataupun 24 jam sekiranya tiada demam, tanpa mengambil apa-apa ubat yang boleh mengurangkan demam seperti PCM ataupun COVID simptom lain. Ini menunjukkan perlu menggunakan mask, jauhkan practice social distancing dan tutup mulut bila batuk ataupun bersin. Okay, seterusnya adalah joint local vaccination program to promote community immunization and reduce the risk of spreading COVID-19 and severe diseases. Okay, berdasarkan carta gambar ni, ini adalah studies yang menyatakan unvaccinated individuals are 9 times more likely to have an infection, and the risk of dying from COVID-19 was 62 times higher compared to vaccinated plus boosted individuals. Maksudnya sini individu yang tak mengambil vaksin kemungkinan untuk mendapat infection COVID-19 tu adalah sangat tinggi. Dan untuk boosted individual, mereka adalah 3.4 kali kemungkinan kurang untuk mendapat COVID-19 dan 3.6 kali kurang untuk mendapat kematian daripada COVID-19. Lastly, encourage patients and staffs to screen their health condition to control the spreading of virus among asymptomatic and symptomatic patients or personnel. Okay, bila melibatkan transmisi COVID-19, asymptomatic individu yang asymptomatic bermaksud mereka yang tak ada simptom tapi mempunyai viral COVID-19 juga boleh merebakkan infeksi melalui mungkin bersin ataupun LEO. Dan menurut kajian, penyebaran COVID-19 melalui adalah lebih tinggi dalam asymptomatic patient daripada symptomatic infection. Dan ini adalah sangat vital untuk patient dan personel, lagi-lagi dalam kawasan hospital di mana patient COVID-19 berada. Itu saja daripada saya. Sekian, terima kasih.
In conclusion, COVID-19 has shown us and people outside of healthcare how quickly a virus can spread, as seen in Malaysia's progression of cases. Understanding the virus symptoms, categories, and how it impacts cells provide us with the basic knowledge for developing pharmacological treatments such as antivirals, the vaccine, and supportive therapies. Non-pharmacological measures like masking, hand hygiene, and physical distancing enhances the effort to curb the infection. Last but not least, the COVID-19 pandemic reminds us that everyone must work together to reduce spread of virus and prepare for any future outbreaks more efficiently.